you and I connecting is
Yeah.
important. But I also, because I plan a lot, I'm thinking that we need to have spaces that are building on an institution system where we're taking care of ourselves. That we have to learn how to not rely on this, because as we're seeing, it could all go away. Somebody can come in and hit a button and there's no more money coming.
We're ready. We're prepared. Do not give in to fear. We are fearless. This is not the time to be afraid. This is a time to stand up and fight back and to resist any temptation for them to divide us. We're in this together. The rule of law is on our side. We will not give in, not give up. We will not capitulate. We will not bow. We will not bend. We will survive.
This was an initiative that happened because I was driving around listening to Larry Daniel Favors, and a caller said, what would it look like if everybody listening, she had an organization on helping young people, bridge the gap, in their money to graduate from school and to help them, with the books and stuff, and just because it's tough when you're going to school and you don't have enough money, college in particular. And they said, what if everyone called, who's listening, gave $25, you know, it would solve all. And I said, what would happen if that happened?
What would happen?
Yeah. So I said, let's do it. And Urban View Gives came out of that. But that's why we have to be in community too. So we can get ideas and I'm able to execute. So I'm like, okay, let's put it up. It's up to folks. So tell the people, because you being at the president of Howard University Hospital in this time that we're in, we were talking before you came in about all the cuts, all of the budget cuts to quote unquote DEI. But we were talking yesterday about the particular strike that's going to happen to Black doctors and Black professionals in the medical field because of Medicaid and Medicare. Like it's going to hurt us disproportionately. How are you seeing it play out where you are?
Yeah, Howard University Hospital started as Freedmen's Hospital back in 1862, right? And its whole purpose was to provide, healthcare to freed slaves. And, we are now Howard University Hospital that's providing healthcare to individuals at the most disenfranchised, and we provide healthcare to everyone, right? People with commercial insurance, but the majority of the individuals that come through our hospital are Medicaid and Medicare individuals. We're talking about 40% of our patient population has Medicaid, and that's not a scarlet letter, Karen. It's not. I mean, it's really individuals that are truly the working poor. The majority of individuals on Medicaid are working. 60% of individuals are working, can show you a W-2. And then there's some subset of the remaining 40% that are gig workers that may be mowing your lawn or maybe, cleaning your deck or, washing your windows that are cash based. They're getting up every day, they're hustling, they're making money for their family, but may not be able to show you that W-2 that would qualify them for those work requirements that are in this reconciliation bill that we really don't want those work requirements in this bill. So those are one of the things, if your listeners are trying to figure out what can they call their senators about, tell them that work requirement will be a problem. People will be getting kicked off of their Medicaid because they are not they're not able to re-engage that work requirement. But at Howard University Hospital, because we want to prepare ourselves for any cuts, for any decrease in individuals that have care, that doesn't mean that they're not going to come to our emergency department. Doesn't mean that they're not going to seek care. And one of the things that we don't do at Howard University Hospital is we don't turn anybody away.
That's what I was going to say.
Your ability to pay is we don't say, can you pay? Before we look at your injury, before we look at your wound, before we put a stethoscope on you. We're going to do it regardless. But what happens is, and this is why giving to an organization like ours is so important. What happens is when the bill comes, people can't pay, right? They may not have coverage even today. There is about 5% that are self-pay. And one of the things, and I'll whisper this to you, one of the things is that we're not going after people legally. I'm not suing people that can't pay us, right? There are hospitals that are, right?
Yeah.
If you can't pay them, they're gonna send you a notice. Howard University Hospital, our population, I'm not trying to do that. So
You know,
what happens is
can I just,
we
Dr.
eat
Rogers,
that cost. Go ahead.
let's just sit on that, sit with that,
Yeah,
because this country has devolved into a space of, rabid capitalism at the cost of humanity, profit
yeah,
over people.
yeah,
And that was not the founding. I was even thinking about, I'm sure my mom paid out of pocket when I went to my pediatrician, but it was affordable,
right.
and now that we have these companies involved, these insurance companies involved, everybody's got to get their shareholders cut,
Yeah,
and
yeah,
they put profit over people. The fact that you don't do that. And what's wild is we had this conversation before we knew that Trump was going to be in office doing this stuff,
yeah.
and this is what staying ready looks like, right? Because even if all of this doesn't happen, you still need to be in a position to thrive, not just get by and just get by to pay. Because this has been kind of the story of our Black institutions. They're just getting by. And
That's
as a
right.
result, can't provide the level that some other, well endowed institutions can do. And then we get all of the criticism when you're the one person that people can go to and they're not going to be garnished and have their whole lives upended, because medical debt sends people into bankruptcy more than any other debt. It kills people's entire life because you're going to pay to live.
That's
That's
right.
the one thing you're going to pay for. If it's between living and not living, you're going to find the money. And that's a sad thing that we take advantage of people who are so vulnerable.
Yeah, yeah, and you said it right. I mean, crowdsourcing, understanding our ability to spend 5, 25, $50 to sow into an organization that's taking care of people that don't have care. I've told you the story before. My grandfather was a black bag doc in the 1930s in Atlantic City, and he used to take pies and cakes from some and take cash from others to be able to take care of everybody. And it was those that could pay that did pay, and those that couldn't were subsidized by those that couldn't pay. And that's what Medicaid is. Medicaid is a subsidy, right? It's a subsidy that, quite frankly, doesn't pay for 100% of care. It's a percentage. Anywhere from 27% to 30% of the care is actually paid for by Medicaid. But we're to give a full dollar's worth of care, and we're going to always, and oftentimes it costs more than the full dollar's worth of care. And so, Howard University Hospital is dedicated to providing care, and not just care, right? Because we're the only HBCU that has training residents in the hospital that we own and operate. So we train residents, we train medical students, we train the next generation of physicians, black and brown, minoritized. People don't like that word, but that's the marginalized individuals are getting opportunities to care for people, to become physicians, to become experts. And we do that all here at Howard University Hospital. We're a gem of this nation because we are who we are and are such a historic organization. And we have equipment costs. We have maintenance costs. We have facilities costs. We have the care for those that can't afford it costs. All of those costs right now are being borne by the university, right? And so when community can come together and say, hey, you know what? We want to bring you on a national show that has reach to say, hey, there's people that can give a little or give a lot to help the community. Whoa, this is amazing, Karen. I mean, it is. I'm truly floored to be on the call having that conversation now with all of your listeners wanting to support our institution.
Dr. Roger Mitchell, president of Howard University, and people don't realize being president of a university is the manager.
Hospital,
Excuse me.
University
Did I
Hospital.
say? Okay, maybe you should be president of Howard University. Okay.
No, no,
Howard
no worries.
University Hospital. Sorry. President of Howard University Hospital, Roger Mitchell, Dr. Roger Mitchell. It is mostly a fundraising role. It's management. It's more that than anything. I happen to know because I'm friends with a couple of presidents of colleges, and it's a thankless job. I used to tell my students, because I was friends with the president at Hunter, like, okay, this new building, how you think you got that new building? The new
Right.
door? How you think you got that? That woman's out there. She raised more money than any other president in the history of CUNY. So all of the resources, you could protest her on a lot of things, but it's really about resources. It's similar to voting. You want somebody in that position that can go out and get resources. So you and I connecting is
Yeah.
important. But I also, because I plan a lot, I'm thinking that we need to have spaces that are building on an institution system where we're taking care of ourselves. That we have to learn how to not rely on this, because as we're seeing, it could all go away. Somebody can come in and hit a button and there's no more money coming. When I think about the young people who were housed this week and then given 24 hours to get out, when they just said we're no longer going to fund these programs,
Yeah.
I think about that and I say we should never be at anybody's mercy. We have this hospital founded to take care of enslaved people who were coming out of slavery with no resources, no anything. We figured out how to take care of ourselves then. We're going to have to do it again, but this time permanently. This time be self-sufficient. I'm driving around. There's a JJC center. There's a in my neighborhood a facility that takes care of Jewish elderly, right? There is a school just for Jewish children in several blocks from where I live, and I'm happy that there's a safe place for people to go to educate, take care of the elderly, and to feed themselves. Right? We should have that in every community, especially in this violent space that we're in right now. So I'm grateful that you even wanted to come on. 866-801-8255. So what's the gap like for you? You come in, you're president. I'm sure there's like, oh shoot, once you lift the the curtain, oh, there's so much here that has to be done.
Yeah.
How are you tackling all of the things, and what's the first thing that's going to be in the Dr. Roger Mitchell legacy file?
Well, that's really good. I mean, I took over about 8 months ago, right? September. And one of the big things that we saw literally within 2 days is that our chillers went down. And we had to respond to a chiller outage that didn't allow air conditioning into the organization. And we responded to that. We responded to that like an emergency. I'm an emergency operator, so we responded to that. So one of the big things was our facility and getting our facility really prepared so that it could deal with the shifts in the outside climate. We're in an old facility, so that's why building a new hospital is one of our major goals, right? We have funding, and just to comment on what you said in the past, sovereignty is extremely important. Sovereignty, the ability to be self-determined, but we do that in community, right? So whether it's government dollars, local dollars, philanthropy dollars. We need all those dollars. So I'm not, I would not be able to run a hospital without the government dollars on top of any philanthropy dollars. We don't want the government dollars to go away. But I say that to say this legacy is, providing seamless healthcare to anyone who needs it. And I know that's big, flowery words, but we have been doing that, and now we've raised some good amount of money to build a pavilion. There's some money that's left that we're still trying to raise. So this is really perfect timing, so that we can have a brand new state-of-the-art pavilion on Georgia Avenue right here in the heart of DC for community to be able to do that work. I think that's going to be a major legacy. Whether I'm able to see to the end of the growth of a pavilion or the beginning of the growth of a pavilion, I think that's part of that legacy. And operationally, the first 8 months was really getting under the hood and being operational. I love being operational. And making sure that we are doing all the things that are necessary in managing the organization. But now you've caught me at the time. This is literally perfect timing. We have just started our campaign to raise dollars. Literally, this is our first, official conversation surrounding raising dollars. We're trying to raise 100 million over the next 10 years. That is not a lofty goal. It is a real goal when real hospitals and real organizations try to do this work. It's $10 million a year that we wanna raise to be able to subsidize care, build our equipment cash, and be able to support our residents. Our residents really we need to make sure that we're providing grants to our residents so that whatever exposure they want, from the most, obscure ear, nose, and throat procedure access to general OBGYN and delivering babies. We want to provide them the best opportunity to be able to do that. And sometimes that won't be here at Howard. So we want to be able to pay for them to go to that institution that is doing that so that they can decide and be that specialist. And so being able to fund our residents and our education to a level beyond their just salaries is something that I really am excited about using dollars for.
I love it. 866-801-8255. How important, because I'm looking at the fight that how Harvard is putting up right now. And yes, we should get all of the money from all of the places that I'm not ever saying don't take government money, don't take grants, don't take money from corporations. I'm saying that when you don't need their money is when the money comes more readily. It is a wild thing. I don't know if it's spiritual, Dr. Roger, but I do know when you have money, money seems to follow the money. So if and that's why I think sometimes people fake it till they make it and they buy the cars and whatever. So they, it's almost like you're projecting that. But when you have your own back, you walk with a different confidence. And then people are like, I want to help that. You know what I'm saying?
Yeah.
As opposed to the desperation of not having and the lack of that, right? So I want you to be able to be as confident as possible out in the world, wielding your magic to get more money for the people in your community. So I just wanted to say that. But if you're a Howard grad, because Harvard's endowment is the biggest endowment in university history, period.
Yep.
And it's mostly because the people who graduate also give back regularly, right?
Yeah.
So I'm setting up right now a monthly donation. And it doesn't have to be a lot. It could be $100, it could be $50, but it's that every month money that will help you be able to budget. So people need to understand the business of this as well.
I love it. That's
if
right.
If it's $50, it's $25 a month, it helps you budget. And for me, it's a write-off. Is this a 501c3?
Yeah,
Are we
501c3?
So
absolutely.
there we go.
HUH
There we
Corp
go.
is part of Howard University, so we're a nonprofit.
Okay. I love it. And I love that I had to push you into getting a donate button. I love that. I'm gonna say that publicly because sir.
Listen,
how
listen,
people supposed to donate?
So God is amazing, right? And we've talked about faith in the past when I've been on the show, your show. God is amazing because it's funny, we're on the journey, and then it's, they need tomorrow. We got to get it tomorrow. It's like when people are coming over your house and you got to clean up. I don't know if it's anybody else but me. My house is
Well,
the cleanest when people are coming to visit.
You got kids. Your house is always going to be in a level of disrepair.
Hey, my son, shout out to Matthew Mitchell. He's graduating tomorrow from high school. Give him a shout out.
Yes.
Yeah, but no, I'm glad that you pushed us to and where we are in our journey. But you've said it right. It is biblical. There's the story of the talents. I won't go through it, but the 10 got 10. And the 5 got 5, and the 1 only got 1. So there is trueness in this notion that when you're given, you want to multiply what is given. And that's where we are now. We're really multiplying what is already given and standing on the legacy. And yeah, shout out to all the HBCU individuals, the graduates, anybody that went to an HBCU. We need you to send those donations in. But also if you're in the DMV area and you need care, we want to take care of you. 27 clinics, 28 clinics, brand new AI enforced call center that just started 2 months ago, brand new EMR coming. All of these things, we want to take care of you. We have a dermatologist, Karen, who actually a couple dermatologists that are experts in brown and black skin, Yale trained, running a phenomenal residency. That goes for our ophthalmology. We have a minimally invasive gynecological procedures for women's health. We have minimally invasive orthopedics for hip replacements and knee replacements here at Howard University. Just as good as a Hopkins, just as good as anywhere else. Good, solid, excellent healthcare delivery. And a lot of people just think about us as indigent care or those that don't have, which we do very, very well. But they're getting the state of the art care. And so can you if you're here in the DMV and are looking for a culturally competent provider.
We're ready. We're prepared. Do not give in to fear. We are fearless. This is not the time to be afraid. This is a time to stand up and fight back and to resist any temptation for them to divide us. We're in this together. The rule of law is on our side. We will not give in, not give up. We will not capitulate. We will not bow. We will not bend. We will survive.